Carol, do you think we need to define lines and boundaries in this, or is it just too complex? I mean, I've looked through situations and scenarios from France, the Netherlands, of course, where it all started, Switzerland, Spain, Germany, all over the world. Different issues arrived, and no one ever seems to arrive at a definitive answer. I mean, we've got the same set of circumstances, whether we're in Bangalore or Bristol. It's the same set of circumstances that pop up. There is a theme that runs through this. Do we need to define it, do you think?
I think it's going to be extremely difficult to nail it down. I mean, I've talked a lot about Oregon, but Oregon is a very specific state within the United States, a country.
And there are such extremes in the States when it comes to any kind of law, aren't there?
Absolutely, but when you're looking at some of the states, they're not renowned for their rich cultural diverse mix. And I think in this country, it's not just an issue about what happens to patients, but since Mustafa's been talking, it's occurred to me, how would a Muslim nurse deal with this? Because as a nurse, I've had many patients say to me, is there nothing you can do? Now, that would be very difficult, I would imagine, for a Muslim nurse to cope with. And we need, so it would be great if we could nail it down. We certainly need guidelines from our professional bodies. Hans Christian and I were talking about this in the break, because sooner or later there will be enough groundswell of opinion that this is going to happen. It might take decades, but certainly, you know, you look at the latest polls, 85%, 75% of people in favour of this. Sooner or later something like this is going to happen. I personally think it will protect patients more than harm them, but then it has massive implications for healthcare professionals and the people who support the families of these patients.
And Hans Christian, do you think that the popularity, the high rating in these polls in support of legislation is whipped up by extreme cases?
Thank you. Yes, I agree. I'm sure that there is that as well. I would like to point out one example which I found very interesting. There was some years ago there was a task force in New York that looked at this issue, and they were composed of different people. I understand that were like some lay people, some medical people, some lawyers, etc. And they looked at this entire subject of euthanasia. And initially, you know, there were people who asked, well, what's your views on this? And most of them were actually for euthanasia. Right. Then they studied the implications of euthanasia. Yes. They studied data from other countries and all those, and after 18 months everybody was against it, you know. And I think that happens. I think once you look at it in more detail, you find there is lots and lots and lots of problems. I'm concerned about what would happen. I'll tell you one instance that happened to me a few years ago. I was working in a very busy London hospital. A patient came in with advanced cancer, with prostatic cancer. Within a few days he had died a natural death. Yes. His widow was devastated, and she asked me, "You didn't kill him because you needed the bed, did you?" And I was really upset to hear that. Now, this is a situation where currently, obviously, he was not killed, he died on a natural death. What we need to see is that currently euthanasia is not legal. But still, this lady had the impression that doctors were allowed to kill their patients. Right. Once we legalize euthanasia, we have a situation where patients will not trust their doctors anymore. Because, as one doctor put it very interestingly enough, he said, "I do never want to wonder whether the doctor coming into my room has the white coat of the healer or the black hood of the executioner." You know, I think it's a very worrying situation once doctors are in the position of, you know, of being allowed to kill their patients. The perception is that this is what happens, you know, and I would be very worried about continuing to practice medicine once euthanasia becomes legalized.
Mustafa, how do Muslim healthcare professionals tackle all of these points that we've just raised?
I just want to come on to that.
Please do.
Question by Carol. I think what we have to realise that a Muslim nurse, her duty or his duty would be to first and foremost is support that patient throughout the patient's time in difficulty, whether it's like mental or physical or medical. And one thing I must mention here is that Islam strongly teaches patients, and if you have been put through a certain calamity, if you're a secularist you might say it's for whatever reason, but as a Muslim you might say that God's put you in this situation, this difficulty, you must bear through the situation with great patience. And what we believe as Muslims is that the suffering which one person goes through, and there's a saying of the Prophet that when a person is in illness, then his sins are removed. So the more severe the illness, the more of his sins are removed, the more he is cleansed. And this is the whole concept of religion, whereas we look forward to the afterlife as well. If you think that life is just going to end here,
yes.
and this suffering, this is all what my life is about, this is a kind of limitation in one's mind, whereas if a person has this faith where he knows that I am bearing this suffering now, but one day it will end,
yes.
and once it does end, then I will be rewarded by God through the patience and through this suffering which I have bared, and then in the next life, he will be rewarded and his station will be so high from the suffering he has suffered in this life.
I'm sorry to push you on this point, but I think for our audience as well it would be interesting to hear. A Muslim GP, as Hans Christian is now, would his advice be different from a patient if I came to you as a GP now, as a Muslim GP, and said, I have a degenerative disorder, I know that there is 6 months, 3 months to go, I want to make that decision right now. How would the doctor respond?
I think the doctor, a Muslim GP, would respond by saying that my duty is to treat you in the best possible way and cure you or to relieve your pain. My duty is not as a GP to take your life, you see. This is and I think Hans Christian in his last little expert there said it brilliantly, that it's not the job of the GP to then take somebody's life, and you do, and I have seen issues where Muslims have thought that the doctor has taken the patient's life, and I exactly agree with Hans Christian there, because I know somebody said this to me, that all the doctors couldn't be bothered, so they thought, he's not going to survive end of the day, so we'll just take his life anyway, and they were getting so angry thinking, this person could have died in an accident, in 2 days, and it would make a difference whether he dies now or dies later. This is all something set. But as humans, we must do everything we can, if not to save the patient, and we, in all our means, we must try to save the patient. But we must try our best to at least make that time as easy as possible for him, through comfort, through medical relief, and also just a final quick point is that as Muslims, we also believe in miracles as well. That God can send down a miracle to cure people, and I personally know a person who's told me of a person who was told by his doctor that his cancer was not treatable.
Yes.
Your cancer is not treatable and you will die in such and such months. And he survived after that date. I don't want to go through the whole story. It's for 15 years, and after 15 years he died of a car accident. Really? Not of the cancer.
Yeah.
So and the people around him, their belief was strengthened that it's not cancer that kills somebody. It's actually when your time's up, your time is up.
Yeah, there always will be cases like that.
There always will be cases like that as well.
I'm sorry to kind of draw things to a close almost, because time, as I know, always goes so quickly in these programmes. But just a final thought from all three of you, maybe actually, with regards to where do you think we will be with this debate? Of course, we've seen recently Sir Terry Pratchett offering himself up as a test case in these new tribunals. There are various cases being tested, if you like. Debbie Purdy's case was very much to push the button and to push the limit on this, really, and see how far it could all go. Let's go 5 years into the future. Where do you think we'll be with this?
I think we'll still be having this debate. I think the best case scenario is we would have clear guidelines on when and where the DPP would be willing to prosecute, but I would be very surprised if we had any legislation other than that.
And do you think we're likely to see any prosecutions in the related cases? We've seen 12 or 13 instances where prosecutions or investigations have been carried out. Prosecutions haven't been forthcoming.
The guidelines that were sent out for consultation seem to me to be fairly comprehensive. Also very difficult to measure. You have to be motivated by an act of compassion, no financial gain, all that sort of thing.
Yes.
But it's a comfort to people. It may well keep some people alive to travel their journey longer than they would have done, as we mentioned earlier. So I would welcome some guidelines like that, but I still think we're a long way from legislation, unless somebody with the money like Pratchett will push it.
Hans Christian?
Well, I mean, personally, I do hope that euthanasia will never be legalized, because I really believe that it would, really open a complete can of worms, cause a lot of problems, undermine doctor-patient relationship, will lead to worsening care. Baroness Finlay Landafe, professor of palliative care, she, in her view, she believes that those countries that have legalized euthanasia often have worse palliative care, because obviously always cheaper to kill than to treat a patient, for example, in a hospice setting. So I'd be very concerned about any attempts to legalize euthanasia or assisted suicide.
But the debate, of course,
the debate will continue.
Will continue.
Will continue, yes.
Mustafa, very briefly.
Yeah, I think if you look on this point of freedom, in future years, I think freedom of choice, freedom of opinion, these things are just going to expand, and there's going to be more debate on these. But the problem is when you don't place any limits on freedom of choice, any sort of guidelines on freedom of choice, then you let society run reckless, basically. And you will have even more problems, I think, in so many areas when you say everything is down to the individual person and what his freedom of choice is, without putting any limits and responsibility on the choices that a person may have. And I think this is very important, that it's time now to clamp down on this and to fix some sort of limitations and borders and guidelines onto what do we mean by freedom of choice and opinion, and how far does this extend to.
Indeed. Do you know, it's been a fascinating debate, and I'm sure we could sit here, bar the police going past, we could sit here and discuss this for another 3 or 4 hours and still not really draw any main conclusions, but some very refreshing viewpoints. I think it just kind of helps flesh out the argument. Carol, Hans Christian and Mustafa, thank you so much for your time this afternoon.
Thank you very much.
And that's Spotlight, the first in a brand new series. Let us know what you think. You can always get in touch with the programme. Next week we'll be throwing another issue into the Spotlight, so make sure you join us just after 2 o'clock on Friday afternoon. Until we meet in 7 days, take care.